Well, over the last few days with all those breezy conditions, maybe you've thought to yourself, do I have allergies or is this COVID? You find yourself with that scratchy throat, Ty, or you're sneezing a little bit. What are the differences here? How do we know if it's COVID or allergies, my friend?
Yeah, that post-nasal drip. I don't know. I just like that when they do those commercials, they talk about post-nasal drip. Anyway, the person who knows all of this morning is my new friend, Shelby. She is one of the family nurse practitioners here at CVS's MinuteClinic in Seattle, in Scottsdale. We were talking about your background in Alaska. I don't know where that came from. We're totally off track here this morning, but this is an important topic because you were saying you're getting quite a few people coming into your clinic kind of a little bit worried about, is this seasonal allergies or could this be a little bit more serious?
Yes, it happens at least every day. I have patients that come in, they've been sent home from jobs, they've been sent home from work, and they're coming in with their negative COVID test, and they're going, what do I have? And they don't realize that it's our seasonal allergies. Our pollen counts are in the moderate to high range these days. We have lots of juniper and ash blooming, which are some of our key components in bringing out those allergies. So how do you differentiate is what I'm asked a lot.
Yeah, so tell us, what is the best way to do that, to kind of differentiate the symptoms between those seasonal allergies and potentially something like COVID?
So it is a little difficult because there is some crossover, but with COVID there's some key aspects. So you do sometimes get the body aches, the chills, the fever, and the thing we've heard about the most, the loss of taste or smell. That is something that is very specific to COVID-19. Whereas allergies, you get those burny, scratchy eyes, the ones where you just want to kind of scratch your eyeballs, and you tend to have sneezing. COVID does not have sneezing or scratchy eyes. The lap over comes with the fatigue. Sometimes you can get that postnasal drip, that cough, and then the sinus pressure.
Okay.
And unfortunately, those are the parts that do overlap and confuse people.
You know, it's becoming a lot more easy for folks to get those COVID-19 tests. They're available pretty much anywhere. You guys offer them here at CVS.
Absolutely.
When in doubt, do you say just go get that test to give yourself that ease of mind?
Absolutely. If I can't 100% say this is allergies or this is strep throat or some of the other things that we see in the clinic, I absolutely encourage people to get that testing. One, for peace of mind, and two, so if they are positive, that they're not spreading it to their family members, their loved ones, in our community.
Let's talk about the seasonal allergies, because you mentioned it. Some of those big factors for those seasonal allergies are already starting to bloom here in our state. A lot of people are affected by this. What are some of your recommendations to give yourself that relief that a lot of people are kind of looking for this season when it comes to allergies?
So what most people don't realize is when it comes to our antihistamine medications, they think it's a take-as-needed medication.
Gotcha.
So they go, oh, I woke up today and I have some sniffles. Let's go ahead and take that antihistamine. Well, antihistamines are a medication you want to take every single day because it takes 2 weeks to a month to really get those levels in your system to where they're going to do their job and fight the allergies.
Okay.
So 2 weeks to 1 month prior to that allergy season, if you know every spring I'm terrible, like I just can't see, my eyes are burning, you want to take that medication a month before that season starts.
So get started early.
Yes, get started early, and then avoid your known triggers. If you're always have spring allergies or fall allergies, limit your time outside.
Okay.
Instead of having those doors and windows open that we like in this nice weather, keep them closed and keep your AC on instead.
Awesome.
Because that'll just help eliminate some of those allergens in your home.
Sure. Some great tips. Shelby, thank you so much. We were talking earlier and I got distracted because Shelby has the coolest upbringing. Her family is a whole bunch of commercial fishermen from a little tiny town in Alaska, Homer, Alaska. They're watching right now, hopefully. Hi, Homer, Alaska. So this is so cool. That's what we were talking about earlier. So we have to bring you on and talk about commercial fishing one of these days. But we appreciate your time, Shelby. Thank you so much.
Thank you so much. It's been wonderful.
We'll send it back into you guys.
My goodness.